Hi, my name is Maggie, and this is my Concepts of Nursing Head to Toe Skills Assessment. I have all my necessary equipment. My hair is pulled back and out of my face. I have my badge, my uniform, white tennis shoes. I have my stethoscope, and I have my patient here. So first, we are going to knock on the door, provide privacy, practice hand hygiene. Good morning, my name is Maggie and I'm going to be your nurse today. Can you please verify your name and your date of birth for me?
Mariah Alexander, May 30th, 1996.
Okay, and then can I please verify your wristband? Perfect. So the doctor has ordered a head to toe assessment today. Is it okay if we go ahead and do that?
Yes.
If I can get my gloves on here. Okay. So we've gone ahead and we've taken her vitals. All of her vitals were normal. BP was 120/70. Temperature was 98.6. Oxygen is 99% on room air. Are you experiencing any pain today?
No.
Okay. And BP. So patient is healthy, and we're going to go ahead and we're going to begin our focused assessment here. So I'm going to begin just looking at your head. I'm going to go ahead and inspect your hair, and I'm just going to be looking for any lesions or any abnormalities, okay?
Okay.
Do you mind if I touch your head?
Not at all.
Okay. No issues with the patient's skin on her head. Now we're going to go ahead and we're just going to inspect the skin on the rest of the body. Patient does have 2 tattoos on her arm, no abnormalities seen. Okay, so your skin check looks good. Now I'm going to go ahead and I'm just going to examine your face a little bit. So we're going to go ahead and we're going to start with your eyes. So here I have my light. So pupils are equal, and if you could please follow my finger here. Okay, no issues here. Now I'm going to go ahead and I'm going to inspect the eye, so I'm just going to pull your eyelid down, okay? Okay. Conjunctiva is pink and sclera is white. The other side. Okay, sclera is white and conjunctiva is pink. No issues there. So now I'm going to go ahead and I'm going to look inside of your nose and just make sure that nothing is, that your airway is patent. If you could please look up a little bit for me. Okay. And now if you could hold one side and blow out the other, and the other side. Do you have any issues with that?
No.
Okay. No signs of deviated septum, and airway is patent bilaterally. Now I'm going to go ahead and I'm going to look at your mouth. Could you please open your mouth for me, please? Say ah. Okay. No signs of swelling in the tonsils. Uvula is midline and not swollen. Teeth are intact. Gums are pink and moist, as well as the buccal membranes, pink and moist. No signs of any concerns. Now I'm just going to go ahead and I'm going to palpate your sinuses. Did you experience any pain or tenderness?
No.
Okay. So now I'm going to go ahead and I'm going to check your ears. Okay. Earway is clear, no signs of drainage, and no signs of infection. There's no red, swelling, anything like that. Okay, so next I'm going to go ahead and I'm going to inspect your nails. So here we're going to be checking, so there are no signs of breakages, no cracking, and I'm going to go ahead and I'm going to assess your capillary refill. less than 3 seconds, no signs of cyanosis. And lastly, I'm just going to inspect your lips. Okay, so they are pink and of normal size, and again, no signs of cyanosis. We're going to assess your neck range of motion. If you could please look to each side. Do you experience any pain with that?
No.
Okay, could you go up and down? Any pain there?
Mm-hmm.
Okay. I'm going to go ahead and I'm just going to assess your jugular vein. Okay, no signs of jugular vein distension. And last, I'm just going to palpate your lymph nodes, okay? Did that cause you any pain?
Mm-hmm.
Okay. So there are no signs of jugular vein distension, and there are no signs of swollen lymph nodes. So now we're going to go ahead and we're going to inspect the respiratory system. So if you could just breathe normally, and I'm just going to check your lungs. Okay. And now I'm going to go ahead and I'm going to do one more time and just breathe normally. Okay, now I'm going to go ahead and check the lungs posteriorly. Breath sounds are equal and bilaterally. Are you having any trouble breathing?
No.
Okay. I'm going to go ahead and I'm just going to palpate your thorax a little bit. And please just tell me if you have any pain. Okay. Have you been coughing at all recently?
No.
Or experiencing any pain when you cough?
No.
Okay. So, no concerns with the respiratory system. Now we're going to move on to your heart, and I'm going to go ahead and I'm going to listen to your heart. Okay, S1 and S2 sounds are present, no signs of murmur. Also, upon auscultating her lungs, there was no signs of wheezing, no signs of rhonchi or crackles. Lungs and heart seem to be in great condition. So we're going to go ahead and I'm going to palpate the carotid artery and then continue to palpate the pulses. So I'm going to go ahead here and I'm just going to check your pulse. Okay, pulse is normal, not bright or bounding. Can I please go ahead and check your radial pulse on your arm? I'll go ahead and do this one. Okay, now I'm just going to go ahead and check your tibial pulses and your pedal pulses. Okay, all pulses are +2, and that's normal. I have no concerns with your pulse or your heartbeat here. And okay, now I'm going to ask you to lie down. We're going to go ahead and we're going to check your GI system. Do you have any concerns with going to the bathroom or anything like that?
No.
When was the last time you had a bowel movement?
This morning.
Okay. I'm going to go ahead and I'm just going to listen to your bowel sounds. sounds equal in all 4 quadrants. Noises are heard in all 4 quadrants. So we also inspected the abdomen, and there are no concerns, no lesions or anything like that. Both the chest, no signs of barreling in the chest with her breathing, and in the stomach, everything is no signs of distension, and equal breathing pattern. So now I'm going to go ahead and I'm just going to palpate your abdomen. Please tell me if you experience any pain or tenderness.
Okay.
Did you experience any pain or tenderness with the palpations?
No.
Okay, great. So no signs of any concerns with the abdomen. And I just want to check again, you haven't had any GI issues or anything like that?
No.
Okay, great. So now we're going to go ahead, you can sit back up, thank you. And we're just going to check your range of motion on a few things. If you could please just like that. Do you experience any pain or anything?
No.
Okay. And now here, if you could hold your arms up like this, please. And I'm going to try to push out, and don't let me. Okay? And then if you could try to push out from here. Okay? And now we're going to do the same thing with your feet. If you could prop your feet up a little bit. And then try to push down. Okay? And then try to push out. And in. Okay. Great. Was there any pain with that?
No.
Okay. Now so no concerns with range of motion or anything like that. I'm just going to check your shoulders real quick. If you could try to push my hands up. Okay, great. So no concerns with any musculoskeletals. Any joint pain?
No.
No? Okay. I'm just going to go ahead and inspect your joints real quick. And the capillary refill on your toes, now that your toes are out here, less than 3 seconds, so no signs of a lack of oxygen to your feet. So if you were experiencing some cyanosis, which is a lack of oxygen, your oxygen levels would be low. They're good right now, they're 99% at room air. However, if you were lacking oxygen, one way that you can tell is if your lips start to turn blue, or your hands or your fingers. There are also no signs of any edema, no fluid volume excess. I'm going to go ahead and I'm just going to check your skin here. No signs of tenting. Okay. And do you know where you are today?
Yes.
Can you tell me where you are? Are you at home today?
Yes.
Okay. And do you know what we're doing here today?
Yes. Head to toe assessment.
Yes. Do you know today's date?
The 21st.
Okay.
Sorry.
That's fine. The 21st and
June.
Okay, so patient is alert and oriented
July.
times 4. July. Patient is alert and oriented times 4. We completed the Glasgow Coma Scale test on her. Her levels was 15, so there are no concerns of her in a coma, but ANO times 4, reflexes are, actually we're going to go ahead and check your reflexes real quick. So I'm just going to use my machine here. Okay. No issue with the reflexes. Lastly, I'm just going to assess your gait. So if you could please stand up, and I'm going to ask you to walk over there and then walk back, and I'm just going to be watching your gait.
Okay.
Okay, thank you. So there's no signs of instability. Balance looks great. Patient is no signs of weakness. Gait is normal. And lastly, I'm going to go ahead and I'm just going to palpate your trachea here. Okay, trachea is midline and no signs of swelling. So I think that covers everything for our head to toe assessment. Do you have any questions for me?
No.
Okay, great. So since the head-to-toe assessment has been completed, the patient has been provided education, and we have met all of the requirements from the provider for this head-to-toe assessment. We are going to go ahead. I'm going to remove my gloves. Throw them away. I'm going to wash my hands, and I'm going to provide patient privacy, and I'm going to leave the room to document.